Congratulations! You've just received the latest product innovation from DJO, the world leader in knee bracing. The new CCMI Mark III represents DONJOY's most advanced custom brace measuring device. The custom contoured measuring instrument Mark III, or CCMI Mark III, is unique in the orthopedic industry. This lightweight and easy-to-use instrument provides increased accuracy. Only taking a few minutes to use, the CCMI Mark III eliminates the need for traditional time-consuming casting methods. Custom braces such as Defiance, Defiance 3, Defiance 3 Female Force, and the adjustable OA Defiance are manufactured and shipped from DJO's facility within 24 hours of receiving the patient's measurements. This DVD illustrates not only how to measure patients using the new CCMI Mark III device, but also how to fit their custom brace properly. The Defiance line of braces are prescribed for many types of patients, such as NFL and collegiate football players, amateur athletes, weekend warriors, and individuals who just want to enjoy the best quality of life possible. Low profile and lightweight, Defiance is available in 3 different length configurations: standard femur and standard tibia length, short femur and short tibia length, which is designed for shorter patients, and standard femur and short tibia length for skiers or motocross athletes. For sports requiring a boot, there must be at least 6 inches of clearance between the patella and the top of the boot. If the measurement is 7.5 inches or greater, the standard calf length is fine. It's beneficial to measure this clearance before actually measuring for the custom brace. Defiance provides excellent protection and stability in all length configurations and is available in over 40 different color options. When measuring, the patient must be standing, feet shoulder-width apart, with their weight evenly distributed on both legs. To make the process easier, you can have the patient stand on a raised platform. The patient should be looking forward at all times during the measuring process. Shorts should be worn so that an accurate measurement can be obtained. Attempting to measure over clothes will produce inaccurate results. You want the knee bent at 10 degrees of flexion. Avoid hyperextending or having flexion angles greater than 15 degrees. This will contribute to inaccurate measurements. The new CCMI Mark III has been redesigned with new features to make it easier to use. The patient's knee width is obtained by pushing the load plunger and viewing the measurement through the window as shown here. The patient's varus valgus angle, or lateral offset, is measured in this manner as shown here. Another new feature is the retractable measuring tapes located here to measure for short or standard thigh and calf lengths. Mobility and protection of the CCMI Mark III is important, so we've upgraded the carrying case. The foam-filled case includes order forms, a DVD with instructions for measuring and fitting, and contour paddles. To unstow the CCMI Mark III, simply pull up on the swing arms and rotate them outwards. Pull apart the knee width caliper and position directly on the patient's knee. Arrows on the condyle shells should align with the top of the patella and slightly posterior to midline. Be sure the condyle pads are sitting just above the femoral condyles. For standard thigh or standard calf measurements, extend the retractable tape measure marked in inches most proximal to the knee for the thigh and most distal to the knee for the calf. Wrap the tape measure around the thigh and secure it to the hook on the tape module. Press the tape release button to pull the tape measure snug to the thigh. Ensure the tape measure is parallel to the floor. Repeat the same procedure for the calf measurement. The lateral outrigger should now be flush with both the thigh and calf and positioned at midline. For short thigh or short calf measurements, follow the same procedure except use the metric measurement tapes located just above and below the knee. Remember, where the calf tapes lay on the calf will determine if the patient needs a standard or short brace calf cuff. The desired placement of the calf cuff will be at the belly of the calf muscle or above. To establish proper knee compression for knee width measurement, support the lateral side of the instrument and press the load plunger on the medial condyle until the triangles are aligned. This assures an accurate knee width measurement. Record the patient's knee width, lateral offset, and thigh and calf circumferences on the order form. To record thigh and calf contour measurements, insert the steel shaft of the contour gauge into the snap feature on top of the tape module. Next, wrap the contour gauge around the anterior thigh, parallel with the floor, being careful not to compress tissue. Record the readings in each dial window starting with dial number 1. For dials number 4 and 5, you can simply rotate the instrument away from the patient's groin, then take the measurement. This will make it easier to read. When finished, remove the contour gauge and repeat the procedure at the posterior calf. You are now finished measuring for a DONJOY custom defiance brace. Please note, it is not recommended to measure patients shortly after surgery while the knee might still be swollen. You may have the opportunity to measure a patient prior to their surgery. Once you've received your custom defiance brace from DONJOY, it's important you follow the correct application procedure for the brace. This is the Defiance 3 custom brace. To apply the brace to the patient, have the patient seated on a chair and flex their knee to about 30 to 45 degrees of flexion. Have the patient step through the brace and position the condyles so that the center of the hinge is a finger width above the top of the patella. Next, position the thigh and calf cuffs and then secure the anti-migration strap to keep the brace in place. Secure the strap opposite the calf cuff, followed by the strap opposite the thigh cuff. If these straps are too long, you can simply trim them with a pair of scissors. Next, loosely thread the posterior thigh strap here and then push the hinges posterior on the knee. Secure the posterior thigh strap, not bringing the center of the hinge beyond midline. Followed by securing the anterior calf strap. For the final strapping procedure, secure the posterior calf strap. Now, note that the center of the hinge is posterior to the midline and a finger width above the top of the patella. It's very important that the brace is applied with this sequence of strapping to ensure the brace functions properly. All straps are marked with a number 1 through 5 to ensure that they are secured in the correct sequence. The patient needs to understand that they should not retighten any one particularly loose strap. They need to follow the same sequence of strapping used initially to apply the brace. So first, make sure the calf cuff is secure, then secure the thigh cuff. Now retighten the posterior thigh strap, drawing the hinge back. Then retighten the anterior calf strap, being careful not to bring the center of the hinge beyond midline. Resecure the posterior calf strap. Finally, have the patient reapply the brace for you until they feel comfortable putting it on without any assistance. You are now finished fitting for a DONJOY Custom Defiance brace. Please refer to the fitting instructions included with the brace if further questions arise.